So once anesthesia is done, the surgery can begin. What happens first is to introduce the camera for the laparoscopy or thoracoscopy. So a small incision is made, the port or a little straw-like instrument is introduced into the abdominal chest, and then the camera is put into the abdominal chest. Once that's done, we will look around looking for any obvious abnormalities or any problems before subsequent ports are inserted in the abdominal chest so that instruments can be introduced to do the surgery. The positions of these subsequent ports are also determined during the surgery when you had a look around with the camera. Once that's done, an instrument like this is introduced into the abdominal chest so that the rest of the surgery can be done. For example, for appendectomy, the instruments are introduced to remove the appendix, and the appendix is removed through one of the smaller ports in the belly button. And once that's done, everything is checked that everything is in place, then we can subsequently remove the ports. Once removed, the little holes are closed either with stitch and mostly with glue on the skin, which is waterproof and prevents bacteria from entering the wound. The whole process of surgery may take anything between 20 minutes for a simple hernia repair to something more complex, which may take a few hours. Laparoscopic surgery is very safe and the standards we achieve is very high.